I'm Gilles, I'm an MD, and I'm currently a medical marijuana evaluator and recommender for medical marijuana in Tempe, Arizona. I come from a long background of teaching. I went to Northwestern Medical School and pre-med. I then became a faculty member at Case Western Reserve School of Medicine in Cleveland, followed by becoming the Associate Director of the Family Practice Residency program at the U of A. So teaching is my forte, and I believe that patient education is paramount. So what I do is I'm basically teaching patients a better way for most of the illnesses that are right now in medicine considered incurable. The treatments for which are usually worse than the symptoms of the disease that they're treating. So it is a great privilege for me, and I'm just thrilled. I'm one of the first doctors in our state, in Arizona, to be providing this service. I was waiting for it to become legal. I have researched, and everything I do is in the natural bent. Even though I'm an MD and I was trained quite traditionally, I have gone outside the box almost my entire career. And I have done the bioidentical hormone route, all the controversial stuff, but you know, the stuff that shouldn't be controversial, because there's 50 years of research that this powers that be choose to disregard. Same way with medical marijuana. The research is prolific. The stories, I'm sure you've heard them all. I've seen more patients benefited in this program than I have in all my 30 years of practice. I never, ever wanted to give patients these drugs, these chemicals that I knew had such potential dangers, side effects. Now I can offer them something that literally won't hurt them. And it just gives me great pleasure to do that. I'm so happy that we're legal in the state of Arizona, and that we're one of 16 states that have at least looked at the science and realized that this is something that we should have passed or allowed a long time ago. I don't even understand how they cannot allow a natural God-given plant. Almost all of our drugs are made from plants. They were originated from plant material. How then does this medical and medical treatment for so many things across the board become legislated? Nobody, not even the FDA, can tell a physician what they can recommend in the best interest of their patient for any treatment that we want. Nobody. We can even recommend non-FDA approved drugs. They're considered off-label. But if we believe that that is in the best interest of our patient and in the best interest of patient care with the least amount of side effects, no bureaucrat can stop that. How, therefore, is this any different? I just feel that it would be, I'm doing my due diligence to be able to provide something that I know is safer, more effective, less side effects, and farther reaching than any other treatment for most of the things that I've been seeing. I see patients with debilitating conditions who have run the gamut with all the specialists, every kind of surgery that can be had, and are on a plethora of medications, usually pain medications, that should be illegal. Those should be illegal. Those things are liver killers. They're killing people's kidneys, their brains, their stomachs. They're throwing up blood from vomiting from benign-sounding drugs like ibuprofen or aspirin, neither of which are benign. The fact is that these are the things that doctors are wielding in great, great numbers. I've had patients come in with this bottle for 1 month's supply of 600 Percocet. Because of the way it was prescribed, 600 would be an adequate monthly supply. That doctor isn't under scrutiny, and I am. I just find it incredulous. And at the federal level, for those who have the authority to legalize this and decriminalize it, to say that we don't have enough medical or scientific studies, we don't have enough proof that there is a medicinal benefit is a travesty. Not only a travesty of justice, but it is an absolute, they've totally ignored. It's ignorance is what it is. They have ignored the body of science that I've had the privilege to hear summaries of this weekend at this conference for, Patients Out of Time? Well, I feel like we doctors are out of time. And it's time for us to take a stand and to show forth the bureaucrats, the politicians, whoever it is that denies that there is medicinal benefit. It's time for us to show them. And hopefully, there will be some open-minded people who are willing to listen.
Excellent. I agree. I definitely agree. Are you enjoying your time here, the 2012 Patients Out of Time Conference?
You know, the funniest thing is, this is our 7th annual conference, and I think it's really picking up speed. I'm just thrilled to have the caliber of scientists, patients, articulate all the benefits, the fact that from the very basic science of the endocrine system and the nervous system to find that we have our own endocannabinoids, which means they're just nothing different from the, people say I have chemical depression or chemical or this and that. The chemicals they're referring to are the neurotransmitters in the brain. Well, guess what? We're always giving patients medications, I should say, some of us are, that will help to stimulate that transfer of information from one nerve to the other. Cannabinoids we have them endogenously. We were born with them. And when there is a depletion of them, these symptoms, these diseases are all worsened. Even PTSD, which in my state is not considered a legitimate, qualifying, debilitating condition, which is just so sad for our vets whom I prize. And I just can't believe the fact that this is not considered a treatment, because there is definite evidence that it affects the actual parts in the brain that contribute to the debilitation of post-traumatic stress disorder. It just saddens me, and it mobilizes me at the same time. I'm not going to be so sad that I'm catatonic. I was one of the first doctors to do this in Arizona, and I'll stand up for what I believe. I'm passionate about it. I believe in it. This conference has given me even more armamentarium. So I am about to now educate physicians, as I did when I was on faculty at medical schools. I continually educate patients, and now I'm ready to take on the ignorance, the massive amount of ignorance in the legislation.
So this conference is giving you some things you can take back with you.
Absolutely. A ton of stuff. And I'm really grateful I came.
Thank you so much, ma'am.
It's my pleasure. I'm happy that you interviewed me. Thank you.